Hello, I'm Paul Peterson. No one knows precisely how many older Americans are being abused, neglected, or exploited. While evidence suggests that many thousands have been harmed, there are no official national statistics. However, according to the best available estimates, between 1 and 2 million Americans aged 65 and older have been injured, exploited, or otherwise mistreated by someone on whom they depended for care or protection. There are two types of elder abuse: domestic elder abuse that takes place in the elder's home, and institutional elder abuse in a nursing home or long-term care facility. That's what we'll be looking at today on Aging in LA. Please stay tuned. People enter nursing homes for a variety of reasons. Some may enter for a brief time when they leave the hospital because they need skilled nursing care, medical services, and therapies. Others, however, need long-term care, generally defined as a broad range of personal, social, and medical services that assist people who have functional or cognitive limitations in their ability to perform self-care and other activities necessary to live independently. While most elder abuse occurs in the elder's own home, a significant proportion of elder abuse occurs in long-term care facilities such as nursing homes, out of sight of the general public, and the elder's family. Nursing home abuse can take any form: physical, emotional, sexual, and can include neglect, financial exploitation, or health care abuse. Elder abuse in nursing homes has recently gained media attention, and a federal program has been established to help prevent and resolve such abuse of the elderly. Our guests today are advocates for nursing home reform. Kevin Kane is a graduate of Harvard Law School and for 16 years has represented plaintiffs in elder abuse litigation against nursing homes, hospitals, managed care organizations, and residential care facilities for the elderly. Mike Connors is a member of the advocacy team with the California Advocates for Nursing Home Reform, and for 30 years has worked to improve choices and care for people who need long-term care. Thanks to both of you for joining us. Boy, we've got a big subject here. Kevin, thank you. Tell me, if you would, are we prepared for the future that's coming in terms of nursing home care, the quality of nursing home care?
Well, I certainly don't think so, Paul. There's so much to be done in this area. As a litigation attorney, of course, I get calls probably 5 or 6 a week from family members who have had horrible, horrible experiences in terms of the care of their loved ones in nursing homes. In the 16 years I've been doing this work, I've seen that process accelerate. And there's far too few attorneys doing this. There are far more calls than I can handle, and most of my colleagues who do this sort of work feel the same way. And I've seen a worsening of the types of abuse that I've received calls about. I've had unspeakable things brought to my attention: maggot infestations and, third world conditions that you would never expect to see in the United States and certainly in the state of California.
Well, how did you get interested in this? I mean, it's an unusual and kind of narrow legal choice or specialty. What happened?
I have to say I came to it purely by happenstance, Paul. When I graduated from law school, I took the usual career track of going into a large firm. I did commercial litigation for almost 24 years. And 16 years ago, a friend of mine called me and told me that his grandmother had died of dehydration in a nursing home. And I said, "You must be wrong. You can't die of dehydration in a nursing home. They put an IV in, they keep you hydrated." He insisted that was the case and asked me to look into it. I did, and lo and behold, he was right. And not only that, but I began to find out what was going on in nursing homes generally in California. And I was shocked. I still am, because I consider myself to be fairly well informed on what's going on in our society, but I had no idea how bad it was. So I decided that these are highly meritorious cases. These are cases that are crying out for attorneys to take them and to do something and hold these people accountable. So I just decided to turn my entire practice over to that. I left the big firm, and I've specialized just in doing elder abuse cases. And that's what I've been doing now for 16 years, and I hope to, as long as I can stand up, to continue to do them.
Well, good on you. We need a big-time duplicating machine for people just like you. Thank you, Kevin. Mike, tell me about the choices people make in nursing homes. Are there ways to prevent finding the person you care about in a bad situation, in a bad home?
Yeah, well, the best thing that families can do is be very involved. They need to visit, and they need to be on top of everything.
Yeah.
They need to be involved in care planning at the nursing home, where they have something to say about the care that's going to be delivered, and visit as often as they can. No matter the quality of the nursing home, care tends to improve when families are involved, and they need to ask questions. Family members are oftentimes afraid to ask things. They're not used to being involved in intimate personal care of their parents and loved ones, but
yes.
they need to get rid of those fears when their family member enters the nursing home door, because if they don't check on the care, no one else is going to be doing it.
Okay, well, so unannounced visits, I get that. But so often nursing home decisions are flowing out of a crisis. There has been a problem, and none of us does very well in a crisis situation.
Yes, it's very hard to select a nursing home. Most nursing home placements do occur during a time of crisis. Usually the person's coming from the hospital. There's very little time to make good decisions about selecting a nursing home. So people need to be able to turn to information, help them make good choices. There's a variety of websites, including one operated by our nursing home, by our organization,
right.
That provides information about the background inspection histories of nursing homes. But again, the bottom line is, you can use that information to weed out bad nursing homes, but it's not going to tell you what's a good nursing home. You got to enter the front door of these facilities, and you got to look around, and you got to look for some of the obvious things, like how is the facility staffed? Are there enough people? Do the staff interact well with the residents? Do they treat them with dignity? There's a lot of common sense kind of things that people can intuitively sense whether this is a place that might offer decent care or might be a place that might be a problem.
I got you. Boy, Kevin, I'm almost afraid to ask this question, but can you give me kind of a rundown of what you've had to litigate, conditions that you have actually had to expose?
Sure. My first case after that dehydration case was a maggot infestation of decubitus ulcers and of a tracheostomy site in the course of 11 days in a nursing home. Since that time, I've seen, of course, decubitus ulcers are as rampant as you can possibly imagine in nursing homes. These are pressure ulcers that form from the failure of the staff to reposition a person who is relatively immobile in bed.
We call them bed sores.
Exactly.
For the most part.
And the defense likes to call them bed sores because maybe that doesn't sound so bad. But pressure ulcers, or decubitus ulcers is the technical term, and these result from a lack of staffing, from a lack of enough hands to come in and turn people every 2 hours, which is the medical standard. I've also seen a number of conditions that you never expect to see in California or in any civilized Western country. I recently had a parotid abscess case involving a huge infection of the salivary glands that was clearly neglected for weeks at a time. I have a case right now involving a lady who had a nasogastric feeding tube inserted through the nose and into the esophagus that was mistakenly inserted into her lung, which can happen, by the way, but they are required to check it every 8 hours. And apparently in this instance it wasn't checked for over 24, and this lady died of aspiration pneumonia from having feeding materials injected into her lung. I want to second what Mike said. People often ask me, how should I go about selecting a nursing home for a loved one? And it usually is in a crisis situation. They're in the hospital, they're about to be discharged.
Right.
They'll sit down with a discharge plan and we'll say, well, here's a list. And that's about all the discharge plan will usually tell them. But on that list, invariably, there will be some homes that are better than others.
Right.
And the websites that are available that people just don't know about, in the space of perhaps half an hour, you can get a pretty good read on which are the homes that you definitely don't want to be in.
Right.
And then the others, as Mike says, need to be evaluated. That doesn't necessarily mean they're good, but at least they're not the ones that are truly getting horrible track records with the regulatory authorities. And all that information is summarized for you on the web. And then the next criteria, in my mind, is geography. You want to select a home that is going to be relatively near where you are so that you can visit constantly.
Oh, we made that mistake in our family. You know, the ride to the top of the hill in Palos Verdes became so tedious that we didn't make enough visitations. Mike, what are a family's legal rights? I was astonished when you told me that most of the cases that come to litigation are wrongful death. It's not to improve the care of a living person, but something catastrophic has happened.
Yes. Well, family members have many important rights, and it really pays for family members to get to know them and to learn how to exercise them. Nursing home law is an area of expertise that people don't have when a loved one needs nursing home care. So they don't really know what their rights are, and oftentimes facilities misinform them. But some of the most basic rights, for example, is family members have the right to visit anytime. Not within visiting hours, 24 hours a day they have the right to visit. They have the right to be involved in care planning. I mentioned that earlier.
Right.
To be involved in the meetings. There's supposed to be an individualized care plan designed for each resident that fits and matches their needs. Family members have the right and should be involved directly in those plans. They have the right to complain. If they want to express concern at the nursing home, they can do that, but they also have the right to complain to outside entities. They have the right to participate in family councils at the nursing home that they would run independently,
right,
where family members can gather together and discuss common concerns and present them in a common fashion. It's a really helpful way to avoid the common concern about retaliation.
Right.
People are oftentimes fear, that if they speak out, something's going to happen. When you speak out, through a group, it lessens that.
Right.
It's a safer way to complain.
And who better allies than the other people who have family members in that facility? It's good to get to know them. There's no secret anymore that there's a family in need.
Almost every nursing home has a core of family members who are extremely devoted, who
Yes.
visit all the time, and them working together oftentimes can help be an effective advocacy voice for the residents. Information on all of those rights and more people can find on our website. I know there's information about that.
Yes, we will be
folks
giving
will
a
show.
ton of websites. I'll tell you in advance. Get pens and pencils. Get ready to either record this or write this information down when we get to it.
One
yes,
last
go ahead,
point,
Mike.
Paul, is that not only can family members exercise their own rights, oftentimes they have the right to exercise the rights on behalf of the residents, and residents have their own set of rights
Right.
spelled out under California and federal law. Things like the right to be protected against eviction, so that if people complain, they worry about they're going to get kicked out.
Yes.
Or if they convert from Medicare to Medi-Cal, they're worried that they're going to get kicked out. Residents have rights, and family members oftentimes have the right to act on those rights.
Right. Now there's a wide variety of nursing homes, everything from the full-on 24/7 Alzheimer's units where people are truly sequestered and definitely are unable to care for themselves. And then there are assisted living facilities as well. People kind of slide into these various levels of care. Kevin, can you describe for me the pattern of abuse that exists, say, in just assisted living and then on up to full care?
Yes, very often there are facilities that offer both.
Yes.
They have levels of care as a loved one might age and would need more care. In residential care facilities, I've seen deliberate assault being covered up. I've seen common abuse is people who need more care than the residential care facility is able to provide, and yet the residential care facility will keep them there. That for economic reasons.
Yes, of course.
And that's something that a loved one has to be very careful about, because a residential care facility is not a medical facility at all. And it's not protected by the laws in California that protect medical facilities from liability. They are, in essence, there to provide board and care, feeding, accommodations, etc. And you want to be very careful in assessing your loved one's needs to determine if they need a higher level of care. In nursing facilities, of course, that's where they're going to need 24-hour care. And that's where you're going to see more and more of the kind of neglect and abuse that I get calls about.
Over and over we see the surveys where the elderly patients themselves, the residents, say what they care most about is the level of compassion. Just respect me as a person and just care about me, and it's almost because that's how I would care for you. But we want to talk more about the nuts and bolts of this. But at the moment, it's time for a short break. When we come back, we will continue our discussion of elder abuse in nursing homes. Now, stay tuned. We'll be right back.
You voted for it, we built it. The Department of Public Works Bureau of Engineering promised to improve, renovate, expand, or construct 32 libraries. On time and under budget, we delivered 36.
Last year, there were over 42,000 new cases of AIDS in the U.S., and HIV infections rose sharply, especially among youth. 250,000 more people may be infected and not even know it. Most of these infections were from unprotected sex, which spreads the disease from one person to all of their partners, to all of their partners, and so on. So if you think unprotected sex with one person isn't a big deal, remember, they're not the only person you're sleeping with. Stop AIDS. Protect yourself. Protect your partner.
Welcome back to Aging in LA. Our topic today is elder abuse in nursing homes. And our guests are attorney Kevin Kane, who has represented plaintiffs in elder abuse litigation against nursing homes and other residential care facilities for the elderly, and Mike Connors, a member of the advocacy team with the California Advocates for Nursing Home Reform. Boy, we could go on about this for hours. Mike, what kind of reforms are needed? What's in the pipeline? How do we improve this situation?
Yeah, Paul, there's so many things that need to be done, and nursing homes are regulated at both the federal level and at the state level.
Okay, well, let's talk about what we need to do.
There's federal and state solutions to a variety of problems. But I'm going to talk quickly just about three of the problems that we see as among the most important. First is problems with staffing in nursing homes. Understaffing is usually the core problem, closely aligned with a lack of training for staff and lack of supervision of staff. Those are the core problems that lead to most of the neglect and abuse that we see. There's lots of things that could be done. There's been solutions proposed at both the state and federal level to impose a higher minimum staffing requirement, for example. There's been solutions that have been proposed to monitor nursing homes. Nursing homes self-report their staffing. Often about a quarter of the nursing homes in California routinely violate the minimum staffing standards. We need enforcement of that. So improving staffing would be the number one most important thing that could be done. Another thing that needs to be done is to enforce all of our laws. California has enacted all sorts of model laws over the last 20 years, but our public agencies, our state officials, and the LA County Department of Health Services do a poor job of enforcing them, identifying problems, and taking action in a timely way to prevent abuse and neglect.
Well, we're talking money issues, labor costs and the amount of inspectors you can get out in the field. We're talking about big money.
Right. Right, but there's big money in the system. There's no excuse for not doing better than we do. It's not a lack of money. Medi-Cal, for example, has increased nursing home rates by billions of dollars in recent years, despite California's budget problems. There's a lot of money, but there's not enough accountability, is the point.
Okay, well...
And the last issue I would say,
yes,
excuse me,
go ahead,
is that we need to do a better job of screening out unqualified nursing home operators. These companies turn themselves over and over. They bleed the money out of a nursing home, and then they turn it over to somebody else. And even though it's public money going into these facilities, the public has nothing to say about whether the new operator is qualified or well motivated. That's an issue that Congress is looking at right at the moment.
Well, okay, and that's on a federal level, right?
Yes.
Okay, but we need... You know, California has a really wonderful Commission on the Aging. I'm not saying that because I'm a member of it, but I really am deeply impressed with the passion and expertise of these people.
Yes.
And we tackled the subject, for example, of senior housing and asked the state, successfully I might add, to increase the senior share of the housing bill that we passed for budgetary concerns. But by and large, these residential facilities and nursing homes, these are commercial enterprises.
Yes.
Now, well,
they're
they
commercial
are
enterprises, but they're running on public dollars.
I see.
They act like they shouldn't be accountable to the public when they're running on public money.
Well, now, what about licensure? Can we make that a more stringent process?
Sure, we can make it more stringent. They are licensed already, and they are inspected, but the inspection system isn't getting the job done. It's a different kind of action to try to enforce existing laws as opposed to getting new ones passed. But that's what organizations like ours, what Cantor exists for, is to be able to involve members. People can get involved in our organization and help support our efforts to speak out to try to get better care, better enforcement, better laws, and so forth.
And that was, frankly, Paul, part of the motivation behind the Elder Abuse Act that was passed in California in 1992. It is, in my estimation, based on my legal career, an astounding piece of litigation, of legislation, because what it says, basically, is that elder abuse is rampant in our nursing homes and other facilities and is increasing. Elder abuse is a felony. It's a criminal violation, but it's not being prosecuted because of lack of resources. There are regulators, of course, with the Department of Health Services and other administrative agencies that are authorized and empowered and required to enforce the laws and regulations that apply to nursing homes, and they are unable to do the job, and they are overwhelmed, and therefore the only resource left is the private bar. Right. And so the purpose behind the Elder Abuse Act in being enacted was to encourage private attorneys to take up the cause of abused elders and bring these lawsuits. And I have to tell you, in 36 years of practice, it's the only law I've ever seen that actually says we want to encourage litigation. And the reason we do is because there's no one else to step up to the bar.
Well, there's a tsunami coming. How can the legal profession not understand that this, look, just for economic reasons, this is a place to practice law, to become expert in.
The tsunami is already here. There's a growing number of elder abuse cases every year in nursing homes in California. The numbers have increased phenomenally in recent years. So the problem is here with us already, and the need to act on it is now.
Okay.
So
well, what can litigation, successful litigation against a facility, can it result in substantive change?
It can have an impact, Paul. There's no question about it. And there are certain types of claims that can be brought that can compel a nursing home or a nursing home chain to do better. But it's going to take an awful lot. I really think where the real thrust has to come is legislatively and administratively. Litigation is a last resort. In a sense, it's like trying to do brain surgery with an axe. What you're really trying to do is bludgeon these people into doing better in terms of the care they provide. And it is a slow process. It is a drip-by-drip process. But if more of it was done, it certainly would have more impact. There are certain, to me, very obvious things. For example, you have to have proof of financial performance or insurance in order to operate a car in California, but not to operate a nursing home.
It's unbelievable. How can that be?
There are no background requirements for being licensed to operate a nursing home. I just had a case in which the nursing home owners came from the garment industry and the motel industry and had no background in terms of providing care whatsoever. And their point is, well, we buy the nursing home and then we hire people to do all that. Well, the problem is they don't. And wouldn't it be nice to have some sort of minimal requirements for background to be able to get a license to operate a nursing home? What Mike said about weeding out the bad ones, you would think that, if a nursing home gets a bad enough reputation, people won't go there, and therefore the bad ones would go out of business. It just doesn't work that way. In part because it's all publicly funded. We're talking about Medicare and Medicaid funds, so it's federal and state funds, your tax dollars and mine, in the billions that's going into this system, and yet what comes out on the other end is absolutely abysmal care. And there's really so little accountability because it's public money.
I've got you. Okay. I'm into solutions. I like to fix things. We can all be, rabble-rousers if we want to. What are the best practices? Excuse me, Mike. Where do we find a site? Where do we find the information that tell us what a well-run nursing home looks like?
Yes. Well, I would recommend that people go to our website, which is at www.canhr.org, canhr.org.
CANHR.
Correct, .org. There's a wealth of information there about people's rights, about places that they can turn to for help. We're talking about the global problems here today, but your audience should know that there are places that they can turn to.
They can approach you, Kevin, right?
We operate a lawyer referral service to refer people to elder abuse attorneys so they can find somebody who's qualified. We have a nursing home guide where they can find information about the background of nursing homes, information about the rights, and not just nursing homes, assisted living facilities and other long-term care settings. There's a variety of information, and there are services. You mentioned in your opening the Ombudsman program, for example.
But this is more urgent than we're making it out to be. The number bandied around is 400,000 staff members short right now.
Absolutely.
Short right now.
Surely.
And we're paying these people minimum wage? That
Sure.
we've got to fix.
Yes, indeed. And in my general experience, these people are dedicated caregivers, but they are
my
far too
experience,
many
too.
patients and
Yep.
far too few people to do the work.
It's like our social workers. Unfortunately, our time is up for today's edition of Aging in L.A. Thank you so much to our guests, Attorney Kevin Kane, who has represented plaintiffs in elder abuse in nursing homes and other residential care facilities for the elderly. Mike Connors, a member of the advocacy team with the California Advocates for Nursing Home Reform. And now it's time for our new feature on Aging in LA, Senior Stat Shots, where we look at statistics that pertain to senior citizens. Now get a pencil and paper because today we will share with you internet websites where you can evaluate nursing homes in California, or I hope you're recording this show. They are memberofthefamily.net at www.memberofthefamily, all lowercase run together, .net. Then California Nursing Home Search at www.calnhs.org. Medicare Nursing Homes Compare at www.medicare.gov/NHCompare/home. California Advocates for Nursing Home Reform at www.canhr.org. That's CANHR.org. And you'll find a link to HealthGrade's nursing home reports at www.healthgrades.com/consumer. And that's today's Senior Stat Shot. If you missed any of that, you can call us at the Los Angeles Department of Aging. Now, the department produces this program with CityView, Channel 35, so that seniors living in Los Angeles and surrounding communities are well informed on the many issues that face them in everyday life. And also to let you know of the many services that the Department of Aging offers our senior citizens. We'd like to hear from you with comments on the program, what you like, what you think can be improved, and let's have your ideas for future programs. Please give us a call. The number's there on your screen, 213-252-4088. That's 213-252-4088. Please call with your comments and ideas. We look forward to hearing from you. I'm Paul Peterson for the Los Angeles Department of Aging, the people here at CityView Channel 35, and all of our guests on Aging in LA. Thank you so much for watching. We'll see you next time.